I'm Wim van Hekke, the founder and CEO of icometrix. At icometrix, we're dedicated to developing digital health technology solutions to impact multiple sclerosis care. And I'm very pleased and honored with these great speakers, Professor Klaus Schmierer, also known as Klaus, from Part.1 in London, Professor Shin from Georgetown University, and Professor Cohen from Providence Multiple Sclerosis Center. Without further ado, I'm going to give the microphone to Klaus to start this session.
Thanks very much, Wim, and thanks everybody for coming to this morning's session. This is the title of a project which is currently still under consideration. It's actually been fully considered and reviewed, etc. But as you all know, in the UK, government reshuffles happen on a monthly basis these days, and therefore it's not been signed off by the Ministry of Health quite yet. So this is a project that we've jointly applied for with icometrix, called AI-assisted MRI for quality, efficiency and equity in the NHS care of MS. And next slide is really sort of addressing this important point of MS care to do with highly effective disease-modifying treatment. You all know that MRI is a key tool to assess efficacy, but if you ask any neuroradiologist, they will say, unless they've got research interest in MS, that looking at MS scans is one of the most boring activities in their career, and that means they're getting tired. This is going to be put on the side. There's fatigue involved, and it's prone to error. So icobrain MS is a validated technology for MR quantification with all the qualifications that colleagues from icometrix can explain to you in much more detail. And we're trying to test the technology in terms of how well it detects disease activity and the health economic outcomes of icometrix. So here the aims, let's goes to the objective that we are trying to establish whether there's superiority over visual detection of MRI disease activity in people with MS on disease-modifying treatments, so those who have regularly their MRI follow-up whilst on DMT. Next. We've done quite a bit of PPI, and I'm pleased to say, I'm not sure whether it's true, that Rachel Horn, she's one of our PPI members of the team. She's been running her own surveys, and it's very interesting how keen people with MS actually are to see their scans, to know about their disease from this perspective as well. And if you're interested, all the slides that I'm showing here are also on our blog. Next. This is the team involved. This is a collaboration between icometrix, us at Queen Mary, Barts Health, NHS Trust, and the University of Nottingham, and the respective NHS Trust. We also have support from InHealth, which provides quite a lot of MRI care in the UK, and the societies involved, and the MRAD network in the Midlands of the UK. Next. So here's just a brief overview of the MRI pathway. Yes, so this is now Rachel Horn. She's our PPI member as the patient, just leave it there. And this is kind of her experience, right? So she meets the clinician in clinic and has her MRI scan, and then she discusses that. Next. In the UK, all treatment decisions, particularly switch decisions to higher efficacy treatments, are being done in multidisciplinary team meetings. So this is illustrated here with Rob Deneen, who is now a Nottingham neuroradiologist involved in the project. And then that is being fed back into that discussion with the patient. Next. What the AI technology will add is the external analysis of these scans, providing A, a report, and B, annotated images, which will assist the radiologist identifying change and then influence the further treatment decision. Next. Next. So this is the project that consists of 6 work packages. I will just zoom in on one, which is work package 4, which is the key one, a prospective clinical study. Next. And this is the overview of that. So we're planning to enroll essentially half our follow-up population, at least in advance into this. Obviously, patients are not affected by the whole study. All there is really providing the data for the study. And we have a cluster randomization process, so the MDT will be cluster randomized weekly at each site, Nottingham and us, and both will then feed in the analysis with the primary outcome of patients with MR axis activity, with and without icobrain. Yes, so this is just an overview of the outputs. Obviously, we're trying to provide real-world evidence of the clinical usefulness. There's going to be a health economic analysis that looks at resource utilization with and without the technology. We're expecting the technology to speed up the assessment of scans, and of course then also the impact of more disease activity detected on treatment decisions and clinical outcomes. This will obviously be based on modeling because it's a 3-year study, so you can't expect really long-term assess type of outcomes from this. Next, and I think that's all from me, and I'm pleased to say that this is obviously a study. It will take 3 years, and now you will hear from our friends in the US, who are always a bit ahead of us, about actual implementation, people who are already using the technology in their clinical practice. Thank you.